Hello and welcome to The Issue. I'm Justin Schnepp. Don Pilon has been a state representative since 2004. He is also a member of the Legislative Committee on Taxation. He joins me in the studio to discuss his re-election campaign. If you get re-elected as state representative, would you support raising taxes to provide essential services such as health care or education?
I don't know if we need to raise taxes to fund those programs. I think we need to look at reappropriating money. I don't think we necessarily have to raise taxes. I think it's just a matter of reappropriating money.
And how would you do that?
I think that we have to look at various departments to reassess their budgets, and that's what I mean by reappropriating funds.
Okay. Now let's talk about question one. There's been a lot of discussion about that, a lot of ads on TV. Do you support keeping the beverage tax alive to pay for Dirigo, the healthcare system?
I did not vote for that in the House. Mm-hmm. And I'm going to vote yes on one.
Okay. And let's talk about Dirigo. Why do you support that healthcare plan?
I don't support Dirigo.
At all?
No. I think conceptually, I give the governor a lot of credit for being a leader in trying to provide health care coverage and coming up with the concept. Mm-hmm. I think the concept started out as a good concept. However, pragmatically, it wasn't implemented properly. It's not reaching enough people. There's only 12,500 people benefiting from Dirigo. Mm-hmm. And it's too costly. It's something like $58 to $75 million that we're appropriating for Dirigo. Mm-hmm. Too expensive, too few people benefiting from it. I had submitted a bill this last session, LD 1760, mm-hmm. which was a bill to help the people in the individual market only, people that don't qualify for Dirigo, don't qualify for group insurance, don't qualify for Medicare. Those are the people that might be like real estate brokers, where they work for an employer that does not fund or does not have health insurance, doesn't provide health insurance mm-hmm. to their employees. So those employees have to go into the individual market and buy it mm-hmm. on their own. Anthem provides 93% of those policies in the individual market. They literally have a monopoly in the individual market. The reason for that is in 1993, the legislature created community rating. Now, I won't get into all the mm-hmm. intricacies, if you will, of community rating. But basically, what it does is, if you are a healthy young male and I'm an unhealthy male, you and I pay the same premium. Mm-hmm. So it's unfair. So the healthy young males or females, if you will, mm-hmm. can't afford insurance because I'm driving up the cost. Mm-hmm. You should pay a lot less because you're young and healthy. Right. I should pay a lot more. It's like car insurance. It's mm-hmm. like car insurance. The concept is like car insurance. If you're a good driver, you pay less. If I'm a bad driver, I pay more.
Mm-hmm. So you say you don't support it, but yet on a campaign handout, it says that you will work for quality health care, maintaining first in the nation Dirigo health care.
That is an old one.
So you're flip-flopping on your position?
That's an old...
Right, so but at one time you did support Dirigo and now you're not?
That's correct.
Okay.
And because that is my old brochure. Okay. That you have in your hand.
So why did you support it and now you're against it?
Because, as I said, when I first went into the House, mm-hmm. I believe that the governor's program was a good program, but since then, mm-hmm. I have become a disbeliever in the program. It's not reaching enough people. The governor indicated in the beginning that it would reach 133,000 people. It has never reached that goal. And it's become too expensive, and it's only reaching right now 12,500 people.
So what needs to be done would you repeal it? Would you work to repeal it? What would you do in moving forward? Would you work to get rid of Dirigo? And if so, what would be the solution to this healthcare problem?
Well, again, as I mentioned, I introduced LD 1760, which was going to give relief to people in the individual market. The original Dirigo bill was a program for what we call small groups, small group employers. So that's typically somebody that has 2 to 50 employees, okay? And so that's what the Dirigo bill was supposed to do, go in and help employers that have 2 to 50 lives. And I don't believe that once I started learning more about this program, there truly wasn't a good marketing program to really go out and market this program. And even now that we've gotten a new program administrator, that the plan has now gotten a new program administrator. They had Anthem for many years. Now they have Harvard Pilgrims coming in to replace Anthem. I have not been convinced that there's still a good marketing program to perpetuate the program. So no, that's why I'm not supporting the program.
Okay. Let's turn to education. As we're in an educational institution, what has been your commitment level to the TA community as a whole in terms of education?
I have always been a good, solid supporter of funding not just TA, but all education in Saco. And I've worked with Carl as well as the board here at TA.
Can you name some specific legislation in that regard?
I can't name any specific legislation.
Okay. Also, you say that you support opening doors for higher education. How can you reassure a high school senior, for instance, that is within reach? They can go to college. It will be affordable. How would you work as state representative to try to open those doors for those students?
The governor had an initiative to give credit to young men and women once they graduated from high school to go to college, and if they attended college in Maine, and if they continue to, if they fulfilled their college requirement and worked in the state of Maine, that there would be a tax credit for them.
You're referring to the Opportunity Maine program?
Opportunity Maine, yes.
Okay. Discuss your support for early childhood development.
The program for a K through which one?
Well, in general, early childhood development, how crucial is that, and what have you done to specifically support that as a state representative for the last 2 terms?
Okay. I am an advocate of K through 1 education.
Okay.
I believe that it is necessary to, those are the early learning years for a child, and I have been a supporter of that program, and I will continue to support it.
And how would you, on a scale from 1 to 10, 10 being the best, 1 being the least, how would you rate your constituency services for the last 2 terms as state representative?
9.
9. And can you state why?
I'm very responsive to my constituents. There have been a number of issues over the past 4 years that have occurred. People have called me. They have had a gamut of things that have happened in my district. And I'm very responsive. I've got a legislative aide that I share with 11 other legislators up at the State House. And we're pretty good at getting back to my constituents and resolving the various problems. It's everything. I can't get into specifics with you, but